the March 31st, 2021 special meeting with Los Angeles County Supervisor Kathryn Barger. Welcome, Supervisor, and your staff. I'd say welcome to Pasadena, but it looks like you might be downtown. But still, even virtually, welcome to Pasadena. We'll go on and start with do we need a roll call vote?
We'll do a roll call quickly just to confirm a quorum. Councilmember Hampton is here. I can see him. Councilmember Kennedy.
Here. Let's be here.
Councilmember Madison.
Here.
Councilmember Masuda.
Here.
Councilmember Rivas.
Here.
Councilmember Williams.
Here.
Vice Mayor Wilson.
Volunteer to lead Pledge of Allegiance.
Good morning, Mayor. Good morning, everyone. Please stand. Place your right hand over your heart. Ready, begin.
I pledge allegiance
to the flag of the United States of America,
and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you, Mr. Kennedy.
Welcome, Mayor.
Why is he?
Now we'll move on to item 2, and this is a discussion regarding the federal COVID relief funding and coordination between the county and the city. And Supervisor, this is as we look at COVID relief coming down through the federal government. The question for us has been whether the relief funding will come through the county or through the state. It may vary on the type of relief funding, of course, and so we wanted to have a better explanation from your vantage point. And you may not have all of the answers, but certainly we thought we'd ask because it's not entirely clear. It seems to be clearing up, but at the moment it's not entirely clear, and so we thought we'd engage in a discussion with you and your staff to see if we can't get more information.
Absolutely, Mayor. And I know on the first round, it came directly to the county. And I first want to thank the city of Pasadena, especially your city manager, because this last year, we've had coordinated efforts to work together to address, while you've got your own public health department, costs such as testing and all, are things that we have wanted to coordinate and have coordinated with the city of Pasadena on in terms of funding. Moving forward with this round, it's my understanding the city will receive a direct allocation, and it'll be over a 2-year period. The county right now is planning for the $1.9 billion that we are set to receive, and our spending plan is going to be over a 3-year period. And what I would say to the city of Pasadena, and again, we did this with the first round, is that while you're getting your own separate funding, there are additional costs associated with COVID relief, whether it be loss of revenue in positions that have still had to be put into play, or even the actual cost associated with fighting COVID. I want to work with you to see how we can, in addition to the funding that you're getting, look at what resources are available that could be used for the city of Pasadena. Understand that we are reaching out to all the chambers because my goal is to not grow government, but into, in fact, reimburse and help jumpstart our economy with small businesses and nonprofits that have been disproportionately impacted because of this pandemic. And so we have reached out to the Pasadena Chamber, as we have with all our chambers, to see what needs they have as we look to allocate the $1.9 billion that we're going to get.
And we understand the direct funding. I think we're receiving, look to the city manager, about $52.3 million. But there are other funding streams, including possibly rent relief, that we don't have a whole lot of clarity. It appears that initially it was to go through the county, but now it seems the state will handle that. And my understanding is the county did in fact turn over its rent relief dollars to the state at the request of the state.
Yeah, and I'll tell you why. SB 91 was passed by the Senate, which put in specific requirements in terms of how this money was going to be spent. When we looked at whether, because we always want to keep it local and administer it at a local level, but one of the issues that we had with the state was they were not willing to put together a database, if you will, that we could draw from to see who's already received. So we didn't duplicate the rent relief. And the state said if we did any duplication, that the county would be held responsible to reimburse for that funding. So we decided, because of the size of the county, that we would allocate it to the state and let them administer the program, because they would not indemnify us. Now, the city of Santa Clarita, to your point, cities with a population of 200,000 or more are receiving it directly. City of Santa Clarita has chosen to administer it themselves. They have probably an easier way of identifying those that have already received it. But in LA County, we did decide to allow the state to administer that program countywide. But that's the reason. I mean, if they had indemnified us, we actually asked them and were willing to take part of our funding to allow them to create a database so that we could just simply search to see who received it. But they chose not to do that. And so we just felt it was in the best interest, especially given the fact that we would have to reimburse, and we couldn't go after the people that received it because we know that they're not going to be able to pay back if they are overpaid. So we decided to let the state do it. Yeah, and I would say, Steve, to that point, we're putting together our spending plan now in terms of the 1.9. And again, we're going to do it over a 3-year period. So it's important that we work together. And for example, Mayor, when you all get your funding and you identify how you're going to use that, there may be areas where you want to do a more robust program, and we would want to work with you. Because again, my goal is to especially look at where we can restart the economy. And in Pasadena, because I live in the area, I know that small businesses have been disproportionately impacted, restaurants. And I think it's important that we work
school district. Part of our school district is in Altadena, and that's your jurisdiction. But we consider the kids and the families that attend the Unified School District as being a part of our community and family, notwithstanding the jurisdictional issue. So as we receive funding and we look to mitigate issues of crime and activity that's been occurring recently, we are going to look at better programming in parks, positive activities, and staffing of parks. And so we would hope to coordinate with you those efforts. But also, you're absolutely correct. The issue of local businesses. We've had quite a few local businesses that have struggled, and you and I talked to some of the same people. I know because they tell me. I just spoke to the supervisor, and I know that that these same business owners are counting on the city and the city the city and the county to coordinate efforts in terms of relief for small businesses in and around Pasadena.
Yeah, and I will say that about a month and a half ago, I brought in a motion to reinstate and actually increase funding for our parks and rec, specifically targeting youth, because I know, and you know, how important those programs are. We've got Park After Dark, and so we are actually, and then increasing the time for the pools to be open. So that has been a priority. It passed unanimously, so we actually have fully funded all of our Parks and Recs program, and we're building into that employment for youth at the parks, so that we are actually going to put together a program that is going to allow youth to apply and work at our parks. And I think it's a win-win for the community as well. And to your point on our friends, yes, and they are looking for us to work together to leverage the funding where we can to benefit the community, because I think they feel that they are the fabric of Pasadena, and I don't think you would disagree with that.
Absolutely. Do you, Vice Mayor Wilson, before I proceed?
Supervisor Barger, I was curious, maybe at a higher level, if you could share with the council kind of just the general state of affairs of the county in terms of financial strength. I mean, obviously, municipalities like Pasadena have had a difficult period, especially as you're aware that the Rose Bowl has been a real drain, and it's a great asset, but when it's empty. So I just want to have a longer term view about how the county is doing and how you're feeling about, kind of your resources, so we can be realistic about what capacity the county may have, and whether you're going to be able to step up, or, what that balancing act is, so we have a bigger picture.
A very good question, and actually it's always a balancing act, and I think that your city manager would tell you that as well, year to year, depending upon the revenue. Obviously, revenue's been down in LA County, but one of the things that we have put together is a rainy day fund, which we've had to draw down from in order to balance our budget. So we've been fortunate that we have saved over the years for the expectation, not of a pandemic, but of the downturn in the economy. So we have used our rainy day fund to fill the gap. Moving forward, right now, we are fiscally strong, but it's because we're very careful with how we are providing funding within our county departments. They're all on what you would call a fiscal diet right now in terms of growth. That's why I reinstated the Parks and Rec, though, using one-time funding, recognizing that one area that we know has the greatest need and has been so disproportionately impacted is youth. So we wanted to put together something working in coordination with all of our cities. But we are looking good, but we are very cautious moving forward. We're in negotiations right now with all of our employees, the unions, and are recognizing that we have to be able to sustain for at least 3 years. So, it's to be continued. But right now, knock on wood, we are doing well.
Thank you for sharing that.
And the Rose Bowl, I'm meeting just, and I'm sure you know, Mayor, because I know you're very active with the Rose Bowl. I'm meeting with the Rose Bowl to discuss what options we may have to help them out as well, because I personally, having lived in the community, recognize what an important role the Rose Bowl plays, well beyond just the games within the walls, but also just in terms of the historical significance. And so we're going to see what we can do to work with them moving forward until we get out of this pandemic.
April 15th.
That's right.
Mr.
Yeah.
Masuda?
Thank you, Supervisor, for being here at our meeting, this joint meeting. For mentioning the chambers and your support of the chambers. I actually I've been a member of Pasadena's chamber for a long time. I spoke to Paul Little yesterday, and he really appreciates your support through the years and all that you're doing. We talked about this personal care and retail recovery grant, and it's really a nice grant. Our question is, for your next round, would you consider fitness centers, spas, and yoga studios, because they've been hit really hard because of this shutdown order? So that's our question. what about those businesses and other businesses down the road?
So, the good news is we put this grant out, and the bad news is there was not enough money to go around. So we know that small businesses are struggling, and the EDC did a study that showed that disproportionately small businesses have had been hit the hardest. And the individuals that are being laid off are people that are earning $15,000 or less. So, I mean, we know the impact this has had on our workforce. The short answer is yes, we're going to look at everything because we recognize that that especially fitness centers and yoga studios have been disproportionately hit as well. So we're open to looking at that, recognizing that there's going to be a finite amount of money and it's going to have to be competitive, but we want to do what's needed in the community. So and so we will work with Paul, we'll work with all the chambers to put together a list of who can qualify. But it's kind of like with the vaccines, the more people you let in, the less dollars there are to go out, but we want to be sensitive to what the needs are in the community.
Thank you. Thank you, Mayor.
Councilmember Williams?
Hello, good morning. Thank you. I would like to echo Councilmember Masuda's comments and from our chamber to really support. It's not, what's so ironic about this is that we shut down the very things that would keep us healthy through COVID, which is recreation and fitness. So if there are any funds, even from a public health perspective, to assist them, then maybe that's as a preventative measure to help keep the population safe. Maybe that's another option to look at. And then I do want to ask you a question about, we've had a pretty big shift, which was going to happen, was underway in terms of the type of work and people working from home. We're going to have a lot of shifts here. And so how can we work with the county, this is sort of a longer term question, to invest in high quality jobs and the training that we need to be able to accommodate this new adjustment? We have a very heavy service industry in Los Angeles. We have a heavy freight industry in Los Angeles. Our unemployment is 40% higher than the states, I think, due to that and tourism. How do we sort of look going forward at bioscience and other types of jobs that we are well positioned for and we can do training for, to try to kind of help elevate everyone and sort of put people back to work that have maybe been in displaced industries?
Yeah, and thank you for that question. I mean, the bioscience in LA County has been a priority. Supervisor Ridley Thomas started it and has really kind of jump-started that whole bioscience industry and making LA County a hub for that. I have to say that it's, for me, because my focus has been on the corona as chair for the last year, it's something that we have to revisit. But in terms of service and industry, I think what we're doing in LA County, and I'd be happy to share with the city of Pasadena, is we're putting together what our new workforce is going to look like. Because what we're hearing is a lot of people are not going to be going back into the office. Telework is going to be something that is the new norm. And I look to county council, for example. County council is now putting together what they call, I think it's called a hostellery. Hotellery. A new word, but it's basically they're going to have places to come within the office, but they're not going to have a dedicated office. They're going to be working remotely and only come in as needed. And so I think that the bigger question is going to be, how do we work together to address that moving forward? Because that is going to be the new norm. And I think it's important for us to collaborate not only with the city of Pasadena, but with all of our cities to recognize that, especially with the occupancy rate is going to go down. I know Glendale's experiencing that right now. And how do we come out of this recognizing that we're going to have to do business differently? But with the bioscience and other industries, clearly we have to collaborate and work to provide a robust program. But again, I think it's going to look a lot different than it did pre-COVID. I think that we're going to have to adapt to that and work with each industry to support and change whatever that's going to look like. But we're still working through that in terms of, we had a meeting yesterday to talk about what the county is going to look like come July 1st, because that's what we're looking at as a possible date to begin to slowly reopen, and that's to be determined.
Thank you, Supervisor. And even in all of the efforts in the Antelope Valley with clean transportation and manufacturing and rail car manufacturing, these are all really great jobs that, and Pasadena's really well positioned. So we're here to help. We have a great sort of tech and medical and research base here, and we're really here to help. I mean, that's, your efforts there have been outstanding. So really appreciate it and look forward to working with you. Thanks.
Mr. Madison, followed by Mr. Kennedy.
Thank you, Mayor, and thanks, Supervisor Barger, for this meeting as always, and for your strong support of Pasadena on the board. I just was curious, from the county's perspective, you know, the news today is that we expect very soon to have perhaps even more vaccines than we need nationally. And I know one thing we're struggling with is persuading, if you will, everyone in our staff and really in the city to get vaccinated. How is the county doing on that? For example, you have many multiples of the number of staff employees that we do. I wonder if you have percentages, or have you considered a mandatory vaccination policy, which the EEOC says is perfectly legal and appropriate? I think a lot of people are struggling with that.
Yeah, we're not there on the mandatory, but we are seeing the numbers go up of people that originally were not willing to take the vaccine, now willing to, especially with Johnson & Johnson. We're finding, I mean, my concern was that people would view Johnson & Johnson as less of a vaccine, but in fact, it's the opposite. People are preferring to get Johnson & Johnson versus the Moderna and the Pfizer. And so as we get that coming in, people are really being more willing to get vaccinated. But the county's not there in terms of mandatory, and we're just trying to encourage our workforce. We're going out into the communities the hardest hit, where they've been disproportionately impacted, especially in communities of color, and trying to work with them, getting community leaders from the community to explain why it's so important to get vaccinated. You know, it's something that, again, I think come July, when we are beginning to reopen, we are going to be revisiting that. But I hope we have too much vaccine, more than we need. We're getting a huge supply this week. I don't know where Pasadena is. I think you get your supply directly from the state, if I'm not incorrect. But we are getting the largest supply this week, and we are going to continue to see that grow. And I am encouraging everyone to get vaccinated and to recognize that this is science and it's been tested. I know there's a reluctancy, but Dr. Go, I don't know if you want to add anything in terms of Pasadena and working with the county, but we're not there on the mandating.
Well, because we have limited time, we do have an agenda item on item 3. Why don't we just bold that item to this discussion? It seems appropriate. And we'll turn to Dr. Go to talk to us about vaccination in Pasadena and our efforts. It seems it falls right into this item as well.
Thank you, Mayor.
Go. But I'm sorry, and then I'll turn back to, before we do that, why don't I turn to Councilmember Kennedy, who's next in the queue, and then Dr. Go will turn to you.
Mayor, I believe my question can wait.
Okay. So Dr. Go, and we'll consider this item 3.
Great, thank you so much, Mr. Mayor.
Mayor, item 3 is the mental health services item.
Oh,
and
I'm
item
sorry.
4 is the vaccination efforts. If you want to.
Thank you. I meant item 4. You're right.
So we're going to move to item 4 now.
Yeah, it's update on vaccination efforts, and it seems that the discussion has led us there. So why don't
Okay, so
Mayor,
we'll skip to item
okay.
4.
Mayor,
we'll just fold it in.
Mayor,
Mhm.
if I may just have maybe a couple minutes, because I was going to ask those questions under 3, but they'll be rather quick.
Well, 3 we're going to come back to, John. we're going to continue the discussion on vaccination while we're here.
Okay, good. Then
Yeah.
I'd like to have some brief comments or ask some questions. Thank you, Mayor.
Thank you.
Again, welcome, Supervisor Barger. It's always good to have you with us in this joint meeting, particularly when we can request additional funding and you normally do everything you can to facilitate that. What I would like to know, if the county, particularly your office, has thought about providing free facial coverings to everyone in the county through some kind of program where a resident in the county would make the request of your office.
We started with our county workforce, and it is something that we are considering because it's clear to me that, the assumption is that everyone has access to face coverings, and in fact, they don't. And so that is something that is going to be considered. The question is going to be how do you get it out into the community? And so we are looking at that in terms of maybe working with our fairly qualified health clinics, working with our nonprofits, but it is something that is being looked at in terms of PPEs.
Fantastic. And then in your acceptance of the $1.9 billion, is there room in there for public safety grants that are not related to enforcement, but in terms of encouraging our young people, particularly those under the age of 19, to be involved in other activities, positive activities, as we open up as a society?
I can speak for only myself personally in terms of my priorities, and that would be one of my top priorities. And again, that's why I increased and reinstated the Parks and Rec allocation, because I do really believe that our youth have suffered greatly over the last year, not only with education, but also with recreation. And I think it's important that we invest in them. So the answer is yes.
Thank you. And then one of my colleagues on the council asked about youth in a different context in terms of facilities where people recreate, sports facilities, et cetera. And I'm not sure which one of your deputies are on the line, but I'd like them to take a note that Robinson Park is in need of a small amount of money to close the gap so we'll have a real pool and pool house for the young people who live around that area, predominantly minority and some economically impacted. I want to see that. I think the council wants to see that done, but we've had some funding challenges. And if your deputy would take that down as a possible priority, I'd greatly appreciate it.
So we'll look at our parks allocation through the proposition and see if there's any money available. Have you all submitted an application for funding under that program?
City Manager?
Councilmember, off the top, I'm not sure if we have. I know we applied for another grant and we're not successful, but I'm not sure if it was through the county.
Okay.
All right, Steve. So Steve, why don't you, we'll reach out and get the information and then ask that you submit just an application for the grant for the funding. Because the pools were one of the things we did reinstate, recognizing, especially as it gets hotter, that is a very popular destination for a lot of our youth to go. And so I'd be happy to look at that.
I think that's giving the admonition from the mayor. I'll stop here, but I want to make sure that at the end of the meeting, Supervisor, that I ask another question related to public safety. So I'll have the question. Hopefully there'll be time to talk to you about that on camera, but if not, certainly I'll just give you a call. Thank you. I appreciate it, Mayor.
Thank you. And I would add to the pool question, the Villa Park pool as well, that needs renovation. And I know we've got that planned. So let's move on to Dr. Go and a report while we're on this item. of,
Mayor, I just wanted to chime one last thought in for the supervisor, and it's a follow-up on the question that Councilmember Williams asked around remote work. And Kathryn, you'll remember, I think there was a conversation you and I had, and I remember a lot of publicity around the development at Newhall. And the remote work thing, I think, there was a lot of conversation about traffic and commuting, and I'm wondering, once again, I know if you're transportation deputies here, but I do think the idea of remote workforce and how that changes makes developments like that, which I think could be really important in terms of housing availability, a lot more viable versus kind of people who have to go through these incredibly difficult commutes from more remote locations. So I do think there's kind of a silver lining here. I just wanted to flag that as you are thinking, strategically.
Yeah, and Newhall, as you know, was based on staying in the community and building infrastructure and business within the community so that they weren't commuting out. But I truly do believe that it's going to change the way people use our roadways and commute tremendously. And we're seeing that with Metro, actually.
Okay, thank you, Mayor.
thank you. Dr. Go?
Thank you, Mayor Gordo. So I'm very pleased to give a quick vaccination update. Can I get the slides?
Yeah, we're gonna pull those up right now.
Thank you.
Mayor, while they're pulling up the slides, I just had one question I want to follow up on.
Sure.
Supervisor, thank you so much for being with us. This is Tyrone Hampton. As you mentioned, reinstating the park programs and hiring of student and youth, will there be some dollars that come to Pasadena? Because I believe if Pasadena students are, well, at least if they're PUSD students, if they live in Altadena, Sierra Madre, they could apply for our Summer Rose program, which is a general fund dollars that we put into that. So I was wondering if your office could work with the city manager's office in helping allocate more dollars so that we could try to get more youth employed in our city as well, because we do have that crossover there in Altadena.
Right, and so right now the allocation is for county parks, Altaloma, and the parks located in the unincorporated areas and that are run by the county. But again, that would be an example to Mayor Gordo's original question about the 1.9 billion. How can we leverage our resources to benefit both the city and the county? So that would be an example of where looking at what the county is doing and seeing how we can duplicate that in the city of Pasadena to enhance services that you're providing at your parks would be an example of the perfect way to leverage the dollars from the new federal dollars coming in. So I'm open to working with the city to see if we can allocate some of those resources.
Thank you, Supervisor. And then to follow up on Councilmember Williams' question about the retraining piece of it, I just want to let you know that as a Foothill Workforce Development Board, and I'm sure all the workforce development boards, please lean on us to help with the retraining of people to get these new career paths.
Yeah, and thank you for reminding, and I apologize, Councilmember Williams. I was going to mention our workforce development. We are looking at pivoting, and that is going to be something, to your point, Councilmember Hampton, that we are going to be looking at to collaborate and recognize that we're going to have to do training in a different way. And I forgot to mention that when I was answering Councilmember Williams' question.
Thank you.
Can everybody see the slides that we've posted for item 4?
Yes.
All right, Dr. Go, I think.
Great, thank you. So next slide, please. So to date, of Pasadenans who are 16 years and older, that's everyone who is qualifies for a vaccine as far as the approved by the FDA for a vaccine. 51% have received at least one dose of a vaccine, and more than 30% are fully vaccinated. So we're very pleased with this progress. We have ordered and brought in and been allocated by the state over 67,000 vaccine doses so far. And you can see that that's over 60,000 Pasadenans with at least one dose, and more than half of those have been fully vaccinated. 20,000, more than 20,000 of those doses have been allocated to the health department, but that leaves 2/3 of our total vaccines ordered really have been distributed to providers in our network. That includes mostly our hospital, but also other providers like OptumServe and doctors' offices and our federally qualified health centers. So you can see that it's a network of partners really providing vaccine to our residents. Of note, 40% of the people who we vaccinate in Pasadena are not Pasadena residents. So we're really happy to contribute to the vaccination effort regionally. And we actually expect that role to increase as we switch onto the MyTerm platform, which is the state platform, which will allow anyone to register and come into our clinic. Next slide, please. This is just over time, from week to week, you can see an increase in the percent of Pasadenans vaccinated. And I hope that we're seeing a slightly increase in the rate of increase, that the curve is sloping upwards, that really reflects the amount of vaccine that's being made available to us. Next slide. So we look at our data based on, of course, by race and by age as well. But you can see here that what we have discussed before is that there is a difference in the rate of our Pasadena population as far as the rate of vaccination, and that the rate for our Latinx community members is less than half the rate of vaccination for our white non-Hispanic community members. And so you'll go to the next slide and you'll see that when we look by age, it does improve slightly for seniors, and that we are so happy that more than 94% of Pasadena residents who are 65 years or older have received at least one dose of vaccine, and that the number for all populations or all races in this age group is higher than the general population because they've been eligible. But we still see that disparity in the rate of vaccination by race. Next slide, please. So what are our strategies for offering vaccine to our community? So our mass vaccination sites include our MPOD, or medical point of dispensing. Currently, the picture here that you see here is our MPOD at the Pasadena City College parking garage, which we're very grateful that they've made available to us. And we can vaccinate up to 2,000 people per day, 230 people per hour. We started at Victory Park and expanded our operation as we got more supply and were able to increase our capacity. Also, a really important partner has been Huntington Hospital. They've been a really great partner in not only vaccinating their healthcare staff initially and their employees, but also really opening up their doors to our community members and taking our referrals and working very closely with us to make sure that we're maintaining the eligibility prioritization and also bringing in as many community members as possible. So they're offering us 2,000 appointments per week. And the population served, you'll see the list here, is consistent with the county and is consistent with the state required prioritization. But we're so pleased that that as of tomorrow, people who are 50 years and older are now able to make appointments for COVID vaccine. And then April 15th, we'll be moving to the 16 years and older population. Next slide. So what we recognize is that the people that we see coming through our large-scale MPODs are different from the people who are most highly impacted or have been most impacted by COVID-19, and that we need different strategies in order to make vaccine accessible to them. One of those is, of course, our strike teams of nurses and administrative staff who have gone in to support vaccination in congregate living facilities. We have over 120 different congregate living facilities in Pasadena, and also partnered with the federal pharmacy program to do that. We have many, many different kinds of community vaccine clinics, and we partner closely with our community-based organizations and to identify where we should go. We've also used contact tracing and our case data to identify hotspots where we think that we need to provide vaccine coverage. So first is our health department, which is located in Northwest Pasadena. That's some of our zip codes with in the lowest healthy places index quartile. The school district, and we are looking forward to not only offering vaccine to their staff and employees, but also to their families. We are partnering with places of worship and have had so far a vaccination site that's been very successful at the First AME Church, and that's co-located with a county-funded testing site. So it works out very well to provide that resource in that neighborhood. We are working to offer clinics at our community centers and our parks. We have gone to grocery stores. And so the picture here you can see is from Baja Ranch, where we had set up a pop-up clinic, and with great response and great success. And then Huntington Hospital, shout out for them for also partnering with us on providing these community clinics and really bringing out teams of staff, pharmacists, pharmacy students, nurses, to help provide and extend our reach in the community, including at the NAACP offices, Endelon, and Harambee Ministry. Next slide, please. So this is the last slide. Just to talk about some of our other strategies, we have a strategy to provide vaccine to homebound individuals and their caregivers in their homes. We have had, again, success at a permanent supportive housing complex in Pasadena. We have vaccinated individuals experiencing homelessness, and that has also been supported by county teams as well. We are allocating vaccines to Planned Parenthood, which is accessing and providing vaccine to different populations. We are also allocating to USC Keck, and Bond has been a really great, exceptional pharmacy partner in providing pop-up clinics for schools and also for workplaces. And I also just wanted to mention that our federally qualified health centers, I have one more slide after this. Our federally qualified health centers, we have been allocating vaccine to them and supporting them, but also that they are now eligible for direct allocation from the federal government. So the last slide. So we have different strategies that we have to use to be able to reach all of our neighbors in our community. And so we offer multiple options for appointments and vaccine types. And that includes not only, for those who don't have access or aren't able to navigate a often complex online system to make appointments. We have our call center that has gone above and beyond, not only taking appointments, but also doing proactive outreach to seniors in particular to sign them up, and also provide other services while they're on the phone with them if needed. And then it's been truly a multi-department effort, and I think I really appreciate working at the city level, being able to mobilize very, very, very quickly, and with the support of the city manager from our staff from all departments who have worked as volunteers and also as long-term staff supporting the COVID response. And we have a very active outreach committee with over 35 community-based organizations that are doing social media promotion, but also making these phone calls and doing warm referrals to sign up their community members' appointments. And we are also being creative about using our resources and flexing our teams up and down as needed. As the number of cases goes down, we are able to redeploy contact tracers to do vaccine outreach and sign people up. And that's it for my slides. Happy to answer any questions.
Thank you. Questions, comments?
Well, I just have to say your numbers in terms of vaccinations in the African American community is better than the counties, and I'm really impressed with the outreach. We're now incorporating faith-based into, we have been, but we're doing more robust in areas that have been hardest hit, and I'm really impressed with your numbers. Your numbers overall mirror ours in terms of white, Latinx, African American, Asian, but in terms of the amount of vaccine you've gotten into arms, it's really impressive, Dr. Go.
Thank you. We really rely on our community-based partners, our community partners, and they've done an amazing job doing that outreach that's needed.
Mayor.
Mr. Kennedy, then Mr. Hampton.
Thank you.
Thank you, Dr. Lane, for your presentation. And really, I want to say thank you for your leadership throughout the crisis going forward also. We have a expectation that you will provide stellar leadership even going forward. We're not out of this crisis, as you know. There's been a tremendous uptick of positive cases across the country, and particularly in jurisdictions that are opening widely in terms of getting people back out and moving. So we're going to be paying particular attention to the recommendations that you're making for safety for our community, our residents, our businesses, and hopefully they'll be followed, because the recommendations you had made prior, making currently, have helped us keep our numbers down. It's obvious, we're not hiding that there were some problems with skilled healthcare facilities. We're going to address that in the presentation at some point today. But overall, I would say with what we've dealt with, there's somewhere between a B+ and an A- for your efforts. And this is a tough place to work, and I guess you know that. Other health directors have said goodbye, and you stuck with it, and you've made Pasadena better and our residents safer for your leadership. I want to thank you for the partnership with Huntington Memorial Hospital. I think that's critically important. I think all of the council would agree, but they can speak for themselves. That's critical and has been critical to our success. I want to know, what are we doing to address the difficulties that we're having, particularly in the Latin community, and then although numbers are decent in the African American community, I want to see what your thoughts are there as well. But the priority right now appears to be doubling our efforts for the Latin community.
So we have found that our community clinics are the way that we are most effective at reaching our Latinx and African American community members. And so we, while we really enjoy running efficient MPODs that can vaccinate 2,000 people a day, we recognize that we are really need to invest in those smaller community clinics that do 50, 100, or 200 in an afternoon. So we, it's not just getting out there and being there and being there with the syringes and the vaccine. It's about all the work that goes into promoting and bringing people to doing the education and bringing people who want the vaccine to that community location. So we are working really hard. Again, as I mentioned, it's our community partners that are key here. And that includes our healthcare providers who serve those communities. And so that's why our federally qualified health centers are really key as well. So we are going to forge ahead with those strategies, because every time we have one of those clinics, we see a bump up, a really satisfying bump up in those numbers in those racial groups. And so we know that that's what we need to do to provide vaccines to them.
And can I just add on to that, Councilmember, that what we're finding, and I think Dr. Go, you would agree, they're trusted in the community. And a lot of this issue surrounding vaccination is trust, in terms of it's happened quickly, is it safe? So working with our community-based organizations, especially federally qualified health clinics, has given credibility to the vaccine. And so we're also of the belief that while the pods serve a purpose, getting the doses into those small clinics is worth the effort to spread it. Even if it's 50 doses, that's 50 more doses getting into someone's arm that may otherwise not have had access to the vaccine.
Thank you. Dr. Go, Kaiser Regional Office is in my district, and that's their administrative area. But Kaiser as an institution also has a facility at Foothill and I believe ANDRÉ. And we also have the Kaiser Medical School. And I'd like to know, is there any coordination? This is for the supervisor and Dr. Go. Is there any coordination in Pasadena related to Kaiser Permanente?
So Kaiser receives an allocation from the state directly from the top. I've heard about 20% of vaccine goes to Kaiser.
30.
And so they're one of our top vaccinators as far as Pasadenans, where they're going to get vaccinated. So we are appreciative of their efforts. As well, we've been working with the Kaiser Medical School to get an MOU in place because we want to offer their students the opportunity to be in our community. That doctors aren't always the best vaccinators. They need a little bit of training because they're not nurses. But we're looking forward to providing that opportunity for the students.
And I would say, actually, I've heard it's closer to 30% that they get, but either way, they've been good partners. We've coordinated with them. And in fact, up in the Antelope Valley, our pod is run by Kaiser and is open to all, not just Kaiser members. So they have been a good partner in coordination.
Thank you very much, Supervisor and Dr. Go. If at all possible, I'd like to see pamphleting or pamphleteering at our restaurants. In my district, I have a whole host of successful restaurants, even though some are struggling. Visitors.
And we've done that in the county. I don't know about the city, but we actually have specific pods, closed pods for restaurant workers.
We've done direct outreach to all of our restaurants to get people appointments for vaccination, for sure. In addition to me passing out my business card every time I go to get my takeout and making sure that people get vaccinated, although a lot of young people who work at restaurants have told me, have been very ambivalent about it. And so we will continue. Does outreach in the streets and connects with people who are experiencing homelessness. And we are planning to staff with a nurse to provide vaccine to those individuals as well. We want to get more Johnson & Johnson supply. As Supervisor Barger mentioned, that it's been very popular. And so we want to be able to offer that because it's just one dose and makes it a little easier for those individuals.
Oh, so that's really good to hear. Because I was reading another article, a story about how in some places they were using the Johnson & Johnson staffing with a nurse to administer vaccine in person. So that kind of leads me to the next question about our other population that is extremely hard to get to, which is our Latinx population. I mentioned at our last city council meeting, and I don't know if, you know, where you guys are at on that, but we have an idea of where, I believe you have an idea of where, at least based on, you know, geographical maps and things like that, of where the population is just not going to get the vaccine, or they're not walking out, they're not scheduling appointments to go get the vaccine. Have we thought about any more about the conversation I had about staffing nurses with community members to go knock on doors and ask people if they want to get the vaccines? Because realistically, some people just are not going to schedule an appointment to go get a vaccine.
Thank you. Go
Can
ahead.
I just add one thing, Dr. Go, that we're doing in the county, recognizing that a lot of these people work during the day and can't take time off from work because they don't get paid if they don't show up. We're actually doing extended hours and being more flexible in terms of when we are providing the vaccine. And in the Latinx communities specifically, we found that that's been part of the barrier, is the inability to take time off. Because if they don't show up, they don't get a paycheck. And so Dr. Go, I don't know how y'all are going about doing that.
Yeah, we also offer extended hours, evening and weekend. But also we found the demographics of, for example, people who come to our Villa Park clinic is different from, again, the people who are at our MPOD. So we know which locations are accessible by walking that are in the neighborhoods where people live. And we are also doing walk-up appointments, so you don't have to have an appointment scheduled ahead of time. And so we will do whatever it takes to offer the vaccine to people.
I'm sorry, I didn't hear the last. Maybe you said it in your statement. Are you looking into working with organizations to actually go knock on doors? Is that what you said, or am I not hearing you? Okay.
We, for example, our community partners at Endalon, they made a great effort to get folks in and fill our appointments. And then at Villa Park, we have recreation staff who have relationships with people in our community, families who are Latinx, and they've done a great job also bringing people in.
So we're talking about bringing people in. I think we have to go to people. I really applaud the efforts of what you're planning on doing with our population, with people that are homeless, that don't have homes. We have to do the same for the population that is just reluctant to go get a scheduled appointment, go to a parking lot to go get a shot, or go to a location to go get a shot. We have to knock on their doors, and we have to have a nurse ready to administer a shot. If we're really trying to hit that population, sometimes you have to bring it to them. I was just talking to some seniors over the weekend by phone. It was really interesting. I was talking a group of men and some older women on the phone as well. And basically all of their wives were the ones who scheduled the appointments for them. They were like, well, I wouldn't have scheduled this appointment if it wasn't for my wife. And probably, that probably goes for most men. They may have not scheduled an appointment if it wasn't for their wife or someone else letting them know to schedule that appointment. There are just some people that are just not going to schedule an appointment. And so if you did have the shots available at the barbershop for that younger population that is more reluctant, if it's right in front of you, you may think twice about it. I know that there are a lot of people that are even in my age range that are like, I'm absolutely not going to take it. But if it was, and that's because there's so many barriers right now. You have to, of course, their age range, my age range doesn't even qualify. But if they did, they'd have to probably schedule an appointment. Some other factors that would have to roll into it. And if it's right in front of you, you may say, okay, it's one shot. That's all I have to, it's one shot and we're good to go. One shot, you get your paperwork, you're good to go. All I'm saying is I think we have to think about this in a different manner. The people that are going to schedule an appointment, they're going to get it. There is a population of people that are just not going to schedule those appointments. They don't see, not saying they don't see the value in it. I'm sure that they do see the value in it. They just don't see it as a part of their actual day.
Yeah, I'm in agreement. And so our job is to take down those barriers and make it a part of their day. For example, as we plan to vaccinate families at school, at drop-off or pickup, or other ideas such as you said at the barber shop, we are open to all of those and we will pursue those.
Rather than take time on our efforts, let's focus our discussion on coordinating with Supervisor Barger and the county around vaccination.
I appreciate that. No, I was mentioning that because if funding was an issue, I was going to follow back up with the funding question. Is it that we're not doing it because we don't have the funds? And then I was going to ask the supervisor if she'd be willing to coordinate with our city to see if we need more funding to staff nurses to go out to do this type of vaccination.
Well, Dr. Go, you work with Dr. Ferrer very closely, and I know in the first round, the issue of testing, we reimbursed and provided funding for you all. Obviously, we want to get the vaccine out. We're doing a lot of mobile units. You know that we are a partner, and we'll continue to collaborate with you on that.
Thank you.
Thank you. Thank you, Dr. Go.
You're welcome.
Councilmember Williams, followed by Councilmember Rivas.
Sure, just one point and then one question. Councilmember Hampton is right. People have had an amazing experience getting the vaccine. Someone told me it was better than watching Hamilton.
That's a high bar.
So we really have a unique ability in Pasadena to partner with our local organizations and deliver health in a very personalized, sensitive manner. And I hope that going forward, you probably saw the Pasadena Star News article. I hope that going forward, this really puts Pasadena in a position to get more funding for our public health activities, all public health activities. And I hope that we can really push for that, Mayor, as a council and as a city, to expand and support our locally sensitive public health programs. I think this is a great example. And then actually taking a step back, one general COVID question about the orange tier. Just wondering why we're waiting until Monday to go into the orange tier, and if the guidelines could be released any sooner so that businesses can prepare to go into the next tier. Thanks.
Absolutely. We can, the press release should have gone out this morning about what's happening, and it's in line with the state and county guidelines. With careful consideration, we wanted to meet the 3 weeks to allow for us to really be confident about the trend. And in conferring with Dr. Davis and at the county and in Long Beach, that was where we felt we should align with the county's timing on this. And so we expect Monday to be able to have all our businesses move into the orange tier, and the protocols will be ready days in advance for them to follow. The protocols haven't changed. It really is a capacity increase. So I think they know what to do, or they've already been preparing.
And I would just add on to that, Councilor Williams, the guidelines stated 3 weeks. So we've been planning for April 5th to be in the orange because the numbers have remained. So when the state made the announcement yesterday, it took us by surprise, quite frankly, because we didn't know that they were going to automatically just say you're in the orange. But we are planning. We want to do this in a deliberate and thoughtful manner. So we're still planning for Monday or Sunday night at 12:01 to be exact, to align into the orange tier. And I think it's important for us to recognize that the 3 weeks is what we've been working based on. And we're 10 days behind in terms of the numbers. And we want to make sure that the trending is still going in the direction that's going to make it safe for us to begin to reopen, because we don't want to have to start closing.
Right.
Thank you, both of you.
Thank you. Councilmember Rivas.
Thank you, Mayor, and thank you, Dr. Go. To the point of county and city collaboration, there is a county DPSS office right here in Pasadena, in fact, in my district. And I'm not sure if those offices are fully open again for in-person appointments or for people to get services and get access to various types of benefits. But if they are opening soon, it may be a good location to do outreach to members of our community, particularly our .NET community that has been hard to reach. Is that something we've explored, partnering with the county to do outreach out of that location?
For vaccine education and access?
Yeah.
Yes. We have a relationship with those offices, and are you referring to DCFS?
DPSS, Department of Public Social Services. Yeah, they have an office on Lake.
Yeah, so we have relationships with that office, and we will, of course, for their staff who already qualified, they've been offered vaccine. But I think you're talking about people who receive services there. We'd be happy to pursue that further.
And
Great.
Councilmember, we'll follow up because I know that we are looking, and I think we are doing it in our DPSS offices, educating our clients about the vaccine and accessibility. One of the issues has been, and I know Dr. Go can relate with this, and is that a lot of them may not have access to internet, and our libraries are closed and are going to begin to reopen, and so many dependent on that. So when I hear Dr. Go talk about walk up without an appointment, that is a huge barrier for many and is a real plus, but we are doing outreach.
And very likely serves the populations that we're talking about, that we're having the challenges with. And so I would encourage
Mayor, just so the supervisor and the council is aware, we received one letter of correspondence on this item expressing concerns about the COVID vaccine distributions at the Pasadena Public Health Department. So that was distributed to the council and the supervisor and posted online.
to probe jointly. And so I'll leave those matters with the staff, and Supervisor, you can coordinate with your staff and see how we proceed.
Yeah, and to add on to that, Mayor, I think with the Boys and Girls Club, with all of our nonprofits that are youth focused, it's coordinating with them as well for after school. So we're working together on that, and so I'm happy to, our staffs will follow up on that.
And I know that on April 15th, the discussion will be had related to the Rose Bowl with you and your office. And we'd all be remiss if we didn't raise the importance of the Rose Bowl to not just Pasadena, but to the region, the state, and really the country. And so I hope that we'll coordinate to see how we can bring some relief to the Rose Bowl in this time of need.
Yes.
But we'll focus on that on the 15th.
To be continued.
Yes. Next, we'll move on to item, I think the city manager made a request to take up item 7 because we can take that issue up fairly quickly. And Mr. City Manager, did you want to introduce the item? This is Heritage Square South.
Yes, thank you, Mayor. Bill Wong, who I believe everyone knows, our Director of Housing, is coming in. He's got a short little presentation. We're very excited about the Heritage Square project. The North project has been a big success, and we expect the South will be, but we have a little bit of a funding challenge, and we're hopeful that the Supervisor's office may be able to close that last mile for us. Let me turn it over to Bill.
Thank you very much. Thank you, Supervisor Barger, Mayor Gordo, and City Council. And also I'd like to acknowledge my former county colleagues, Lynn Catano and Linda Jenkins, two of the best public sector employees you could ever have, and nicest people also. So I wanted to talk about our Heritage Square South project, which has a funding shortfall. Just real quickly, Bridge Housing, who is the developer of this, the nonprofit developer of this particular project, applied to LACTA in their recent NOFA, and because the funding round was oversubscribed, the project is not planning to be recommended for funding. Within the NOFA, there were two types of dollars that were available that Bridge Housing applied for. One is the No Place Like Home dollars. These dollars, unfortunately, do not prioritize senior housing, and this particular project is permanent supportive housing for homeless seniors. And then the Affordable Housing Trust Fund dollars prioritize unincorporated areas, and of course, this particular project is not in an unincorporated area. So we applied for $6 million, $1 million in No Place Like Home dollars, and $5 million in Affordable Housing Trust Fund dollars. But there is an opportunity, and we hope to propose a potential solution, and that is with the American Rescue Plan. There will be a significant increase in home funds for jurisdictions like the county who will receive home dollars. Currently, LACTA uses their home funds for single-family rehab and first-time homebuyer programs. Unlike a lot of jurisdictions, they do not use home funds for affordable housing development, even though that is eligible. So our proposal is to see if the additional home dollars that are coming in from the American Rescue Plan could be used for unfunded projects, permanent supportive housing projects such as Heritage Square. Really quickly, the site is a city-owned site. I'll skip some of these. We have permanent supportive housing. We have several permanent supportive housing projects already up and running. We've been very active in this area. Our homeless count, actually this number is from the previous year's count, but our latest count is 527 homeless persons experiencing homelessness in Pasadena, of which 160 are persons aged 55 and older. So homeless seniors are our largest segment of our homeless population and the fastest growing. 30% are age 55 and older of our homeless population, and this is not unusual. This is pretty common, pretty typical throughout the county. So the project is 69 units of permanent supportive housing for homeless seniors, plus one manager's unit. It's a 3-story mixed-use building, and it's a city-owned site. And there are significant local benefits to the project through local hire, local purchasing, local subcontracting. There has been extensive community outreach done, and we're really pleased with the fact that when this project went to City Council and was approved unanimously by City Council, there was no community opposition. The city has contributed, made a significant commitment already to this project. The land, committing the city-owned piece of property, committing development funds to the project, and also committing our own project-based vouchers to make this project viable. So the funding for the project, the permanent funding, is $39 million. And in red, you can see that we had applied for, our Bridge Housing had applied for $6 million in county funds. The city has already put in the land valued at $6.4 million, plus about $5 million of its own affordable housing dollars, plus project-based vouchers, which are not even on the funding chart. So the county receives about $8 million, approximately $8 million in home funds every year in their entitlement funds for single-family rehab and first-time homebuyer programs, and we think those are fine, great programs, and we propose that you continue to use your normal allocation for those activities, but that the additional home funds through the American Rescue Plan, which we estimate will be between $25 to $30 million, could be used for unfunded permanent supportive housing projects. And so the county could either transfer those dollars to an adjacent home jurisdiction like Pasadena, or probably alternatively, and maybe even better, the county already has funding commitments to some projects located in the unincorporated areas, and maybe you can swap out the funds. You can take out the NOFA dollars out of from the commitment, the NOFA commitment, and replace it with these additional home dollars, and then use the NOFA dollars to fund projects further down on the waiting list, those that particularly are permanent supportive housing. So that's the proposal that we wanted to lay out before you.
Thank you for that. And I will say that I know, as you said, oversubscribed in terms of the number of projects came forward. We're funding the Lincoln Avenue Senior Apartments in Altadena. That was one of the applications that was approved for senior housing. We know that that is a priority because even with rent control, the percentage that it goes up does not correspond with the amount that seniors are getting in income. So we have to recognize that this is a population that's one step away from becoming homeless, and so we want to invest in senior housing. I'm open to working with the city of Pasadena. One of the things that I'm going to bring in a motion to look at, Phil, to your point, is the current allocation of how we use our home funds is for first-time home buyers. And given the pandemic and what we're seeing in terms of trends, I want to ask the department to rethink our allocation for the upcoming year on these home funds to prioritize for projects like similar to what you just talked about. Because while first-time home buyers is important, I think that we should be leveraging, and I think the best use of our funds probably is to rethink how we allocate the funding for at least this coming year and maybe the next year, and rethink the first-time home buyer percentages that we're providing and reallocate it to projects. So that's what we're going to be bringing in. I'm going to be bringing in on Tuesday for a report back, and the turnaround I'm asking for is 2 weeks, recognizing that we are allocating the funding through the 1.9 billion federal dollars. So I want to see what opportunities we have to leverage that.
Thank you very much. That'd be terrific. We appreciate it, and anything we can do to help to support, please let us know.
Mayor, we do have 4 live public comment speakers that we can go to when you want to.
Okay, before we do that, I think this is in Councilmember Kennedy's district, and he has a comment or a question.
Well, first of all, I'd just simply like to say the council has been unanimous in its support of Heritage Housing North and Heritage Housing South. And this is something, Supervisor, that is critically important for the health of our city to get this particular population housed. And it's been extraordinary work by Bill Wong and his staff. And anything that you can do to help us close that gap would be greatly appreciated, not just by me, but by all of the council members and the mayor. I think Bill has offered a way forward, but you are the decision maker, and we appreciate your leadership on such an important matter. And I'd just like to say to Bill, as always, keep us moving in the right direction to housing all of our neighbors who are without homes. Thank you. Thank you, Supervisor. Counting on you.
No pressure, no pressure. Yeah, I'll work with, I mean, Bill knows, as he pointed out, the people within the county. And, you know, I'm hoping that with my motion on Tuesday as a report back to rethink how we are using our formula for this coming year, especially knowing that there were so many more applications than there was funding. That tells me that there's a willingness to build these, and so we should look at how we can partner and fund.
Great. With that, we'll look forward to revisiting that matter and receiving an update from our housing department and your office, Supervisor. Okay, any other Before we move on.
The live public comment, Mayor?
Oh, thank you. Thank you.
So we are going to start public comment on this item. I will call out the names of the speakers that have submitted speaker cards. For the speakers, when your name is called, the staff will enable your audio on the computer. You will click the button to unmute, and then you can speak. You will have up to 3 minutes to complete your public comment. So let's get started with Arita Crowell, followed by Jill Shook, followed by Anthony Manusos, followed by Bert Newton. Ms. Crowell, you may start.
Good morning, Supervisor Barger. Good morning, Mayor Gordo and council members. I do not want to take a lot of time. I simply want to reinforce how important this project is to the community. So much time and effort has gone into making this ready to go. And it would be a shame to see it drop down and not be able to find the funding. It is important for the mental health of our homeless population, as well as good for the community in many ways. Thank you. I hope you'll work hard to find the funding for it.
Thank you, Doctor.
Thank you, Ms. Crowell. Congratulations on being the first live public comment person for the Pasadena City Council. We will turn to Jill Shook. There's two Jill Shooks. We'll enable one.
Good morning. Can you hear me?
Yes, go ahead, Jill.
Yes, thank you. Thank you for making it possible for us to speak. I've been involved in the Heritage Square South and the Heritage Square North for about probably 15 years. And I know that that community for 25 years has been wanting this project. They were willing to sell property in order to assemble and get enough land to get a sizable project. They were committed to affordable housing. There was a lot of fits and starts in finally getting a project that the city council would support. Now that we have one that everyone feels good about, we need to get it done. You know, and as you all know, with the 20-20-20 rule, Heritage Square North infused $6 million into this neighborhood. So it's not just housing, it's economic development. And there's a RAND study that shows that $1.20 comes back for every dollar spent, especially on senior housing, because it's a high risk population. They incur a lot of expense, especially around healthcare. Once they're housed, so much of that expense goes away, and you end up really being ahead financially in society to do this. So $6 million is the ask that we want to see the county to get this funded as soon as possible. It's urgent, so we can finally get those homeless folks that are sleeping in the same site. We've actually, we see them every time we go to the CVS. They sleep and lay in the front door of the CVS. We want those businesses to thrive. We don't want folks sleeping on the sidewalk. These seniors, they don't deserve that. They need to be in housing. So let's get this done. Thank you for taking my comment.
Thank you. The next is Anthony Manusos, and I believe we'll try the one that says Jill Shook as the second one. Anthony, are you there? 1 second. Anthony, can you hear me? All right, we will move on to Bert Newton. We will unmute Bert. There's no Bert, so dropped off. All right, so that completes public comment on this item, Mayor.
Thank you. Okay, more to come on this matter as well. And we look forward to some progress being made so we can see the housing that we've all looked for in that part of our city and the supervisorial district. Next, we'll move on to item
Did you want to go back to
3.
item 3?
Yeah, let's go back to item 3, and this is an update on mental health services provided by the county in Pasadena.
And there's
So,
one
you know,
public comment on this item as well.
Want to do public comment first? Mayor, I don't care.
Sure, we can do that.
Okay.
Rita Crowell, we will bring you back into the meeting. Ms. Crowell, go ahead.
Good morning again to all of you. I'm anxious to hear what Supervisor Barger is going to say about mental health services in Pasadena, but I do have an appeal. We need more outreach and supportive services for the homeless population here in Pasadena. We know that the county is trying hard to expand its outreach that is not done with police, but is done on the CAHOOTS model, which is health and mental health people available to deal with crisis situations in the community, not simply with the homeless. We have a pilot of the CAHOOTS actually operating in Pasadena with our fire department. And it would be wonderful to see this expanded. The county does give 3 mental health staff to work with Project Hope, which is a joint with our police department from Pasadena, and that is a valuable service. The fire department program is called PORT, Pasadena Outreach Response Team, and they are funded now with federal dollars, doing a wonderful job. We need more of them, and so we look forward to working with the county to expand the mental health crisis response services that come outside law enforcement contact. So it fits well with many of the public policy initiatives. I think I look forward to hearing more from the supervisor and from the city as we work to expand these important mental health outreach services. Thank you for your time, and I appreciate this opportunity for public comment.
Thank you.
Supervisor?
That completes public comment on this item.
So Dr. Crowell, full disclosure, is the reason why I have a passion for mental health. She's our former director of mental health for the County of Los Angeles. So I appreciate her calling in, and it's obvious in retirement, she's still even more involved between Heritage and working with our outreach teams. And she's absolutely right. We are looking for the models that take law enforcement out of the equation and provide more mental health clinicians doing outreach, not only in the homeless community, but throughout the community. And so, it's important for us to continue to work with our 20 partners that we have throughout the Pasadena area to do outreach. I want to emphasize, though, that in the school districts, this is something that I'm looking at very closely. I talked to Dr. John McCall yesterday with DeVille about the linkage between the school districts and mental health services, recognizing that if we can link those services, it can extend to the families, recognizing that if there's an issue with a child in the schools, sometimes it does have a direct nexus to families, and so we want to make sure that we're getting those services out there. We're doing a 24/7 support line that is in play. But it's clear that one of the areas that we have to work on, and I think PSAs are going to be necessary, is to destigmatize mental health services and recognize that everyone at one time or another needs the support. And with this pandemic, isolation and even apprehension and going back to work are real. And we're going to see an increase in the number of services that we're going to have to provide to our people within our community. But this is an ongoing struggle, and getting the resources out into the community is something, not only with the homeless, but just across the board, is a priority of mine moving forward.
Thank you. Supervisor, on as you know, with Pasadena having its own health department, I think it's important to remind the community that the county provides mental health services in Pasadena, notwithstanding we have our own health department. Mental health services are carved out and are the responsibility of the County of Los Angeles. And so one of the questions that's come up in recent times related to the pandemic, but also outside of the pandemic, is the different portals, if you will, for accessing mental health services in Pasadena. Where are they, and how do people in Pasadena access those services? I don't think we probably don't have the time to go through the list at the moment, but it would be very helpful if your office would commit to bringing representatives of the Department of Mental Health to a future council meeting, so we can have that information. I think that's the issue, is one, given the county is responsible for providing mental health services, not just during COVID, but to the broader community, particularly the homeless community, dual diagnosis community. How do we access those services? And then two, as we wind our way, and you touched on this in your comments, as we wind our way through COVID, how will we do things differently to provide mental health services to kids and adults who are struggling with mental health issues as a result of COVID, or even going back to some sense of normalcy. And I think that's what we would like to hear. And maybe we can look to the city manager and schedule that presentation at one of our regular council meetings in the near future.
So we had a representative from mental health on who had to take off, but I'm happy to commit to having someone at the meeting, and I'd even be happy to come back because this is a passion of mine. This is something that I feel very strongly about, and I feel that we need to do more. And when you look at the rate of suicide, while it has not increased in adults, it has in youth. And so we have a lot of work to do, and I want to coordinate with public health. In Pasadena, you're absolutely right. I think that LA County provides mental health services to Pasadena. The Tri-City is the only one that has their own separate agency out in the East San Gabriel Valley. But it's important for us to coordinate because when people are in crisis, they don't want to have to navigate a bureaucracy. They need to get services and they need to get them immediately. And so I'm happy to work with the city on that.
That's an important subject, and I know it's something that you and I have worked on since the early 80s.
That's how I met you. Yeah, no, seriously. I mean, and so you understand, and that's why it's a passion. When you cut your teeth on these issues, your passion only grows.
Well, certainly did that. So I would ask that we commit to re-upping our work from the early 90s and see how we can work together as a city and the county to improve those services in Pasadena. And so I'll ask the city manager to reach out to your staff and we'll schedule that.
Yeah, and then we can talk about, we're increasing hospital beds as well, especially for the homeless that need to be stabilized, that right now we don't have access to beds to stabilize and then get them into community-based services. So we'll discuss it. That's a whole board meeting.
Vice Mayor Wilson.
I'm glad the supervisor mentioned it because I specifically wanted to ask about a mental health capacity for our homeless population, which though we didn't do the count, I'm confident anecdotally that population has only increased and many of those in desperate need of services. I did have one follow-up conversation. I mean, with the schools being closed, I've read lots of, unfortunately, articles about our youth being impacted. I'm curious from a mental health kind of strategy, and maybe we can cover this when we're back together, is how closely the county offices are working with our school districts. I just think that, so many of our youth have been left out, especially I think our underserved populations have really been most impacted. So I'm deeply concerned about what the mental health issues will be in that population.
Yeah, I completely agree with you. And the school districts, we are working closely with them as schools come back into play and have more in-class learning. And that's exactly why when I talked to Dr. McCall yesterday, I want to find out what's going on with Pasadena Unified to make sure that they're getting the resources moving forward. And so I think that that's a key area, quite frankly, Councilmember Vice Mayor Wilson, in terms of coordination with our LACO, Office of Education, working with all of our school districts because beyond that, there isn't apprehension of kids going back into the classroom. They want to on one hand, but they are afraid because they're hearing a narrative about, people dying and, this virus and all. So we have to be cognizant of the fact that there's going to be a lot of services that are not necessarily one-on-one therapy, but overall working to help kids deal with the anxiety. And that's why, again, we've got the after school and the recreational programs, because for many of them, those recreating is a way of releasing a lot of that anxiety and tension beyond just the classroom.
Excellent, great to hear.
Okay, any other comments? Otherwise, we can defer that matter to a council meeting. That's a long discussion.
Mayor, I had just one.
I don't know if you can see me, Mayor. I've been raising my
Oh,
hand.
I can, for some reason,
It probably switched to speaker view, which mine did as well. I don't know why.
you're right. Go ahead.
So I have done a ride along with the Hope team, and we're scheduling a ride along with the Port team. But one thing that I observed, and I think 2 suggestions for items that we could talk about at a later time, is one, I think it would be very helpful to have our own social workers and mental health staff in our public health department as opposed to coming from the county. My understanding is they have limited shifts. They can't be there all the time. They're only there during the day, and we can't really run them at night when other mental health calls come in. So that's when you see just police officers showing up to a mental health incident because the social workers are off duty or not available. So having 2 dedicated social workers in the public health department and funding that, I think would be very helpful because they would be here, they would be local, and we could use them sort of round the clock. The second thing that I noticed is that when dispatch gets called with a mental health call, they have some difficulty asking the right questions to understand what the mental health issue is. So having a trained dispatcher, or at least one of the dispatchers who can go through a list of mental health questions to get the right help out to the individual, I think would be very helpful. And those are very good comments about the CAHOOTS program that we received from the public. So just looking at that, but those are 2 areas where I think we could make some big differences that would change the way we respond to mental health incidents. So thanks.
Thank you.
Mayor?
Mr. Hampton?
Yeah, so just really briefly, I know that we're talking about this summer and after school programs and things like that. Have we trained staff to recognize what potential mental illnesses a child could be going through as they're coming to these after school programs or working these jobs? That's both sides, from the city and the county. I was just wondering if staff is trained in any ways to recognize some of these things.
Councilmember, I don't have an answer on that. I can find out and get back to you because, to your point, there are signs with children if they're withdrawn, if they're starting to give away things and all, but I don't know what the training has been for our rec staff.
City Manager?
Similarly, Councilmember, I'll need to follow up with Brenda Harvey-Williams, our Director of Parks, Recreation, Community Services. I know we provide training to our staff, but I want to get clarity on whether we provide training on spotting types of warning signs. So I'll get that and follow back up with the council.
And if we're not, I hope that you're planning on talking to staff about doing that. And then I would just say to the supervisor's point, to try to figure out if PUSD is prepared for this. As one that was previously a school board member, and that felt like a decade ago, I have to say, and I'm still very involved with PUSD. And I mean this with all due respect, they're not prepared for that. And it's evident. We have a field trip to the field every year at the Rose Bowl. And of course, we didn't have it this year or last year. but hopefully again the coming year. And at this field trip to the field, I'm there at every single one of them. I speak to the youth. We have a motivational speaker, and then we give our young people time to reflect and just ask them questions. And this started during the Great Walkout. The reason I bring this up is because we're there with PUSD staff, their teachers, PE teachers, parents. I mean, there's a lot of, you know, when you have 100 kids, you've got to have 50 adults to manage it all. So our young people felt that it was a comfortable place to talk about the things that were going on in their life amongst all of their peers, which was incredible. And I thought that PUSD should be doing more things similar to this. Or maybe it's because we're not doing as many field trips. Maybe that's just not happening anymore. But not just the field trip, but just having the discussion with the young people. I mean, young people were telling their whole story about molestation, about their grandfather may not be there for another Christmas because he has cancer, about their mom being locked up in jail. And the teachers and staff that was there, they were all extremely surprised by these discussions. And so that's the reason why I said that PUSD is not prepared for it. We just have to do better. We have to recognize these things, and we have to give our young people that space. We have to give our young people the opportunity to express themselves, because a lot of the times there's a lot of adults talking about what young people need, and there's no young people in the room.
So, Councilmember Hampton, what I'll say to that, though,
sorry about that monologue. Go ahead.
No, but PUSD may not be, but they are going to be, and that's why I reached out to some of the providers, because if they are not, we will work with them, and then I will bring it to your attention, and then I'll let the city council get involved if need be. But if they're not prepared, and that was one of the concerns I have, is moving forward. So if they're not, we will make sure that we let you know, and we will work with them to make sure they are prepared.
Thank you.
And I just want to say, as one individual council member, anything I could do to help with that conversation, if you want me to be there, definitely. If you want me to even come and talk to some kids, train me right, and I will definitely do it, because it's beyond speechless when you hear about a 12-year-old who has attempted suicide or taken their life.
Right.
So thank you so much, Supervisor. Really appreciate you.
I'm glad to hear that there are efforts through the LA County Office of Education to prepare school districts. I also think that we should keep in mind the number of independent schools that we have in the area that serve kids and families in Pasadena and in the region, and provide access to those same services for those schools as well. So we'll work with the city manager and the supervisor's office to bring back this issue, to talk about access to mental health services or portals to services, to talk about schools, including PUSD and independent schools, and to talk about mental health services involving COVID specifically, and particularly as we come out of COVID for everyone. And then also, I'm glad you mentioned, Supervisor Barger, the issue of bed availability for people in serious crisis, because I think we've all had constituent calls where we've been told family members are in desperate need of a bed, and the bed simply was not available. I think the low number of beds available for people in serious crisis, mental health crisis, is frankly an embarrassment and needs to be improved. So I'm glad to hear that that's an issue you're focused on.
Yes, and actually we're working with the Biden administration. The state has submitted an application for us to get a waiver to increase reimbursement. So Huntington Hospital, for example, to increase their bed capacity and actually get reimbursed for the services provided. So stay tuned, and I may reach out to you, Mayor, to work in coordination with us on that waiver.
Absolutely.
To the state.
Absolutely, we'd be happy to do that. That's an important issue. I don't know that we're going to have with regard to, I know that maybe we can bring back, I know we have a hard stop at 10 a.m. And so maybe we can bring back item 5 as part of the mental health presentation, and go directly to item 6 to close out the. Mr. City Manager.
It's actually the city clerk. Just to let you know, we do have one speaker on item 6 for public comment. So, and I'd let the speaker know for item 5 that we may not get to that item. So if you want to get the public comment for 6 done, we have that person waiting.
Item 5 may take, and with your permission, Madam Supervisor, I think that maybe item 5 can come back as part of the mental health report. That's a longer discussion involving.
That is a long one, but let me just say, Pasadena has been a great partner with skilled nursing facilities, and COVID's highlighted just how fragile that system is and how much more we need to do.
And I think the jurisdictional questions involving the county, the state, and the city, given we have our own health department, are important to clarify, and maybe we can bring that back as together with the mental health report.
I think it's important. I've got Rob Ragland on. We'll have him come back too, and thank Rob for being here.
Thank you. So again, we'll add that to the report back on mental health at a regular council meeting. So we'll jump into the final item. This is item 6, update on Devil's Gate Dam Restoration Project. Why don't we hear the public comment first?
Sure. We will bring in Nina Chomsky, representing the Linda Vista Annandale Association, and allow her to give her public comment. Nina, go ahead.
Thank you. I hope I can be heard, and good morning to everyone. And I wanted to hear the update first, but I'm happy to jump in. Those of us that have worked so hard on this for so many years, including our leader, Dr. Kreider from La Cañada Flint Ridge, and many of us who are Pasadena advocates and residents for a project that does not degrade public health from poor air quality. And leaving aside all the other controversial issues associated with this project. But we have made a lot of progress. Fugitive dust is handled much better. Now we are still facing the problems of the dirty diesel trucks. And this recent scientific study shows us that we have a long way to go with that. We have questions about idling, the dirty diesel trucks idling, questions about staging. And I know that Supervisor Barger has done a great job in improving the situation. But I want to urge us to continue this effort, to not forget that we have neighborhoods, Pasadena neighborhoods on both sides of the Arroyo. We have thousands of people in the Arroyo recreating daily who don't seem to realize that they're probably breathing, when this project starts up again in April, breathing fine particulate matter along with the freeway fine particulate matter, that it's a real challenge. But the real ultimate challenge is that Pasadena, it seems to many of us who are Pasadena advocates, has just not been all that much engaged or involved with what is a real effort now from the county Public Works Department and the supervisor. So I want to urge Pasadena to get more involved and to be more proactive, and to have our views through our representatives
60 seconds.
And express to the supervisor, and also to support her excellent recent efforts. And that's all, and I look forward to hearing this update. Thank you.
Thank you.
Thank you.
That completes public comment on the item, Mayor. We did receive also 5 letters regarding the Devil's Gate Dam Restoration project, expressing concerns and providing comments regarding the project. That was distributed to the council, to the supervisor, and made part of the record. Thank you.
Why don't we just have a brief presentation? Some of the questions that I've been asked is on the dirty trucks issue. How are we going to ensure that dirty trucks are not part of the project? 2, it seems that last year there were more trucks idling within the project parameters or as they come into the project than the first year. And how will we prevent that from occurring. And then again, you know, Ms. Chomsky points out that the dust we made progress on dust, but we're still seeing a lot of dust leave the trucks and remain on the road, and what we're doing to address those issues.
So and I will just say to Ms. Chomsky that in fact, Pasadena has been very engaged, especially the representatives surrounding the area impacted. And so we've had coordination with the city of Pasadena, and Mayor Gordo is right that these issues have been brought to our attention. In terms of the idling and the fact that we had promised that the trucks would be clean coming in and out, I wrote a letter to Public Works asking them to address this issue, because we did in fact see in the study that the numbers were not what we thought they were going to be, nor should they have been. And so we are continuing to, my office, continuing to closely monitor and watch how Public Works is enforcing the fact that we've made this commitment to the community through the CAC, and Dr. Kreider has been an incredible partner, but the entire CAC has been, the Community Advisory Council has been incredible and engaged on this. But Anthony, I know we're ahead of schedule, so Lord willing, we're already starting to plant the native plants back into the area, but we are ahead of schedule, and I think by the end of this season, we will be done with cleaning out, correct, Anthony?
That is correct, Supervisor. We are ahead of schedule. I believe we have a little bit over 350,000 yards to move out, and that should be done this removal cycle, Supervisor.
So how do we address the issue of the idling? Because I was told that that was rectified in terms of not having trucks waiting in line and idling. What are we doing to ensure that that is addressed?
Supervisor, my team is having ongoing meetings with our stakeholders and our experts to come up with a resolution to this. There's a lot of ideas been discussed. I have Mark Caddick on the line also, who's having those direct discussions with the stakeholders and partners. And we're coming up with different scenarios where we don't have the truck stand in line and idle before they remove dirt. We're looking at having them staged there earlier in the day before. That way they don't have to keep the truck idling as they drive into the facility. So we're having those ongoing discussions with the stakeholders, and we will reach an amicable decision before we start any hauling operations.
And then Mayor Gordo brought up the issue of the dust coming out of the trucks as they're leaving. I thought we had mitigated that by requiring that tarps be put on top or placed on top, as well as wetting it down, so that that doesn't happen. Where are we on that?
That is correct, Supervisor. We mitigated that by having them put tarps on it. We also had the contractor put water to dampen the soil at the facility as necessary. And we monitor the haul routes, make sure we follow it, and make sure that they are not spilling any debris at the litter facility, and make sure there's no dust. So we believe we have adequately mitigated that.
So the good news and the bad news for Public Works is, the good news for the city of Pasadena is that I drive by this constantly at all times of day, and actually take pictures and send it to Mark Pestrella, the Director of Public Works, to let him know that I have been on site. So I'm closely monitoring this because I live in the community, but also the bad news for Public Works is that when I see things like if a truck's leaving without a tarp or something, I will be the first to bring it to their attention, as well as any idling trucks. So rest assured that we are closely monitoring this. We have work to do, Mayor, and again, as it relates to compliance of the trucks coming in, to make sure that they are in full compliance with the agreement that we've made with the haulers in terms of the pollution. So to be continued, but we are ahead of schedule is the good news.
Great. I have received, thank you for that report, and it sounds promising, particularly the fact that you're ahead of schedule. But it sounds like for this coming year, excavation year, we have some work to do. And so I've received requests. I know Councilmember Hampton has been very interested in this issue. I've been very interested in this issue, as well as Councilmember Madison, who also represents the area. One way to receive an update is made to bring the matter to public safety, the Public Safety Committee of the City Council. All three of us are on that committee together with Councilmember Kennedy. So it might be, as things evolve, I'll ask and get clarified. I'll ask that this matter be agendized at a City Council Public Safety Committee, and if you'd be nice enough to ask county staff to come and give us an update, that would be helpful.
Yeah, I mean, I'm all about transparency, especially on this project, and that's why I really am grateful to the community advisory committee that's being our watchdog, if you will. So I will make that commitment, Anthony, for them to be available to come to your public safety. I think that this is an important project, and I really do believe once literally the dust settles, this is going to be a project that is going to be something that many areas are going to want, especially with the native vegetation that we're putting back into the area. I'm excited to be hiking it.
Great. Great. So we'll look forward to that report. Just one question. In terms of timing on addressing some of these issues, when do you anticipate having some of these issues clarified for a report back at our Public Safety Committee?
Well, I can get you a report back. I mean, we can get you something quickly, because the letter I sent to Estrella, Director of Public Works, regarding my concerns about the pollution was like a month ago. So we can get you up. Why don't we just plan on giving you updates on a bi-monthly basis, but we can get you something regarding where we are on the issues that you brought up by early next week.
Thank you.
Mm-hmm.
Okay. Mayor,
Hampton?
if you don't mind, yeah, I'm glad that this is going to be something that comes back to the Public Safety Committee. Supervisor, I want to tell you that I, as well as the neighbors, are gratefully appreciative of your representation when it comes to this matter. Even the fact that you're going out there on a frequent basis to make sure that the mitigations are actually being adhered. I 100% appreciate that. I want to recognize it publicly, but also at the same time, I want to recognize to our city that these are our residents, and I know that you're a resident of the city as well, Supervisor. So I'm just once again appreciate it. Oh well, you're a resident of the area, so I want you to know that I definitely appreciate you. But these are our residents, and we're hoping that one individual or a couple just very concerned citizens are doing the investigation, right? They're doing, residents are actually doing work of staff, which is so characteristic of Pasadena, right? That's what makes it a great tight-knit community. But to the city standpoint, this is, these trucks travel within our city, they idle within our city, and there are things that Public Works has promised that they were going to do, right? And so I believe it's our onus to hold them accountable, whether it be sending letters to just like the supervisor does, right? To say, I noticed there were some trucks on XY day that didn't have tarps. I noticed that the water trucks weren't out there. We literally need to have someone go by that property, even if it's for 10, 15, 20 minutes, every 2 or 3 hours, just to see if they are doing the mitigation. And that could be maybe a code enforcement officer. I don't know who city staff would want to put in that position, but really at this point, there has been a high level of engagement from the city, but there's not been a visible presence from the city. And I think that's where the neighbors are feeling like they've been left out. By the way, I just want to, at least been left out by the city. But I do want to say that, the native plants, the restoration of the proposed plan, Supervisor, very grateful for that. The new entrance that we talked about, redoing that entrance, making it look better than it did when it before, and restoring it back to its natural habitat. Another great point, another great takeaway from this, and also all of the mitigations that have already been in place. I just have to say, once again, very grateful for that, but really it is Mayor incumbent upon the city to make those reports as well as our county supervisor.
Yeah, we'll bring that back to public safety and ask our own environmental health division of the health department, our own public works department, together with the county's public works department, to provide us an update on mitigation and status of the project.
Yeah, and Mayor, I just have to say, you know, we in the county are fully vested in this project because this is going to be a model, and actually it is a model for projects moving forward, especially as it relates to the requirements we're making on the trucks coming in. So this is something that is a standard that we are going to put into play for all of our projects. And the success of this is important to me as well, because the community has been patient and has worked with us, and this truly has been a bottom-up approach. And I welcome the city of Pasadena's involvement working with us. Again, transparency for me is the key.
Great. So we'll look forward to that effort as well. And residents should know that that'll come to public safety, and we'll make it, because there are a lot of residents who live in and around that, right on the edge, and we'll invite them to participate as well. Good, thank you.
I mean, literally their backyards are the Munga, right? I mean, it's the watershed, their backyard.
Yeah. Nice backyard. So with that, I think we've reached our time limit, and so we want to thank you, Supervisor, for making the time and committing to following up on some of these issues. On behalf of the residents and Pasadena, our staff, and the City Council, I want to thank you for your efforts on our behalf. And we have quite a few follow-up items, so we look forward to bringing those back and resolving some of these issues together.
Thank you all very much, and I look forward to working with you. It sounds like we're going to be spending some money.
We are.
I know. There you go. Thank you.
Thank you, Supervisor. And Mayor, I just want to, I think I'm playing a role that you don't want me to play here. Just remember that we're going to adjourn in honor or in memory of those who are impacted by COVID-19.
Okay. Why don't we just take a moment and adjourn in memory of those who are affected by families in Pasadena and beyond who have been affected by COVID-19. Okay, with that, thank you, everyone, and Supervisor.
Thank you, Mayor. Thank you, City Council.
Well, thank you again, and call this meeting adjourned.
Thanks.
Thank you. Have a good evening.
Goodbye.